A lot to digest here, and Dr. Mike joins us to help out and sort of answer some of the questions I know a lot of people at home are asking. Dr. Mike, good to see you. Let's start with what do you do if you've already had the J&J jab in the arm? Should you be concerned?
Well, look, these 6 women developed symptoms within several weeks after getting the vaccine. So let's break it down. If you got the vaccine a month ago, forget about it. You're fine. If you got the vaccine in the last week or so and you have any sort of swelling of the legs, dizziness, headache, numbness or tingling of the face, then you probably should check in with your healthcare provider. Remember, this is an extremely rare complication, a serious one, and that's why the FDA and CDC are really focusing on this. We want to make sure that there's a link there. Maybe there's not, maybe there is. And if so, what group of people should avoid getting the Johnson & Johnson vaccine? That's where the data is going to help us.
And I know a lot of people were loving the idea of one shot and done with J&J, and now they're going to have to pivot to one of the other two. Or should they wait? What's your advice to people who already have that appointment?
I think if you can get a vaccine, get it. There is no implication with the Moderna or the Pfizer vaccines at all. So what we're doing right now is looking at the Johnson & Johnson vaccine and making sure, as they say, with an abundance of caution, that we are doing this in a safe and effective way so people will not shy away from vaccination.
All right, Dr. Mike, thank you. You usually say you love us after the end of these segments. We never say it back, and I always feel bad, so love you.